listen, the Black Women's Health Imperative is known for convening partners and leading conversations that are as real as they are engaging and inspiring. And this conversation will not disappoint. We're bringing to the table powerful voices who are leading the charge on the front lines of policy, advocacy, and health. Please join me in welcoming our moderator, the incomparable Rose Scott of WABE, trusted journalist and truth-teller. Alongside her, we have Kimberlyn, CEO of Represent Georgia, working tirelessly to protect our rights and strengthen civic engagement and get some of y'all to run for office. And Shana Scott, Vice President of Health at the American Heart Association, championing health equity. Yes, we are still saying health equity and access for every community. Let's welcome all of them to the stage.
Thank you all. One of the things that I like to do whenever I start a community conversation, first I want to thank everyone here at the organization, because I get asked to do a lot of these, a lot of times, and I say no one, I say yes, not because I'm mean, but because I have a family too, and so I have to make sure I'm present for them. And also taking care of myself, which we'll talk about that a little bit later, because self-care is important. And if I'm not at my best, I can't be at my best for you all. So this is important to me as well. But one of the things I like to do whenever I start a community conversation is to get the audience involved. And so what I'm going to do is I'm going to say health care is, and you all just throw out whatever you think it is. For example, health care is love. Health care is self-love. Essential. Long life. Strategy. All right. Healthcare is
a human right.
A human right. I like that. Healthcare is power. Healthcare is necessary. Anybody else? Well, it should be.
Unaffordable.
There you go. There you go. Now we get into it.
Complicated.
Complicated. Huh?
Unaccessible.
Unaccessible. Fleeting. And it's ancestral too, right? Absolutely. So as we get our conversation, I want to begin by reflecting on this moment, because all those things that you all talk about, that you figure out are so important. But Kimberlyn and Shana, we cannot escape the fact that we are in a moment that is a little chaotic, confusing, crippling, racist. We're in that moment of things that are happening in our nation. And I just kind of want you all to open up with a reflection on this moment that we're in and how it relates to overall health care in this nation. And Kimberlyn, I'll start with you. That's how we do it, Kimberlyn.
You passed it already. All right. Good morning, everyone. Good morning, everybody. Now, I'm going to tell you, I am a country girl, so I like a little talking back. I like an amen corner. I like to feel like the people are with me. So when I say black, you say women. Black, women. Black, women. When I say black, you say power. Black, power. Black, power. When I say black women, you say lead. Black women, lead. Black women, lead. When I say black women, you say rise. Black women, rise. Black women, rise. So what is this moment for black women? It is our opportunity to understand that visibility is our strength. I know you've seen the memes of us having coffee while this stuff burns down, with our closed until further notice signs on the door. But the real truth of the matter is, we don't run, we don't cower, and we don't disappear on our people. So what does this moment call for? It calls for our visibility, because our visibility is our strength. And what does that look like? It has 3 levels. Our visible leadership, right? And yes, I am going to ask you to run for something. I'm going to ask you to take some type of leadership position. It happens with visible accountability. We can't let these people play in our face. We can't allow these people to tell us that everything our ancestors and elders work for that they can wipe out in 100 days. And last but not least, our visibility is rooted in visible truths. Right now, misinformation and disinformation is pervasive, very specifically with Black men and Black youth. We as Black women are the trusted messenger. It is our job, it is our work in this time to make sure that we are fighting back and combating all of this misinformation about health and healthcare with what we know are our visible truths. And that is that these unalienable rights to clean air, clean water, good health care cannot be denied us. That is where we are. That is who we must be in this moment. And that is visible.
I don't know how you follow that. I don't even know why we up here. That's good. But that's the message. That's the message for today. So thank you, sister, for that.
Okay, so I have to keep going. Why don't you let me go first? She gave me the opportunity. But I'll say something a little different in that in this time, I'm unlearning some things that I thought I knew and operating in a different way than I've been operating before. So the young lady up front said healthcare is a human right. And if you've ever been in any public health class or any public health law class, day one, we talk about healthcare as a human right. I teach a public health law and policy class. That's my day one. And as I enter into this fall, I'm like, what am I going to talk about this year? Natasha also mentioned, you don't need a law degree. And I'm like, I have that law degree. I went to law school to learn about the ways that, from a public health perspective, how do we dismantle the system? I'm a disruptor, I'm a dismantler. How do we disrupt the system? How do we create or identify those policies and strategies and things that cause us to have these health problems? And now I have to start thinking a little bit differently because the system has now redesigned itself to create even more disruption. And so how do we operate in this system effectively and on our own terms is what I'm challenging myself to do as we move forward.
And before we take a deeper dive into this, I want folks to also understand when we talk about healthcare, it's not just about how you are doing physically or mentally. Healthcare it meets so many intersections. There's education, there's transit and mobility, housing, employment. So every aspect of your life, as we call them, all those tentacles tied to your quality of life, your healthcare, everything else is tied to it. Because if you're sick, you can't work. If you can't work, you don't get paid. If you don't get paid, you can't pay the mortgage or the rent. If you can't pay the mortgage or the rent, what happened? Right.
But I do want to say, when you said healthcare, I was like, ooh. I really want to stop it at just health. Because healthcare really is how we're accessing the system,
Sure.
right? How we're getting the provider, how we're, utilizing the system. And so all of the things you mentioned, there's health, there's a mental health, our environment, our employment, education, but healthcare is a part of that health system as well. So I just want to level set there. So because there's a problem with health, but there's also a problem with healthcare as well.
In all the conversations I've been having lately on Closer Look, which I know Argyle listens to every day, noon
Every day.
on WABE, and WABE.org, and in the podcast. What I've been hearing the most, particularly from leaders in this moment, is that they have to engage on a local level with the community. Community is not sort of that broad word, but now more than ever, I think we're seeing this. Kimberlyn, I'll take it from there, the importance of community engagement as leaders. What do you want to say that?
Well, I will say this, all of us have become digital natives, whether we want to or not, right? We're all digital. We're all in some form or fashion tied to these things. We're on Instagram, we're on TikTok, we are very digital. But some of the most effective strategies in terms of our liberation, our education, and our understanding of our visible truths have come from the analog, has come from teachings like this. It's come from us literally being in spaces with one another. And we have to return to that type of format of community engagement. It can no longer be helicoptered, it can't be tweeted or emailed, because one of the things that's happening, and let me just make sure before I say this, because normally I only get invited somewhere one time that I can. So let me just say that. When our people are seeing the pilgrims out there every weekend, protesting with Cheeto Satan and the First Lady Elon, then they are wondering, well, where are our people, right? Where are those organizations and those leaders who are normally out front, right? So they don't see the NAACP, they don't see the National Action Network, they don't see us, organizations even like mine, out here in the street with these protests. And that becomes a concern to our folks, right? Because we know that our institutions are still part of our strength, right? So if I don't see the NAACP out here, if I don't see this organization, I don't see anybody out here, then are we just saying, well, just let them go on and have it, right? And so what Rose is saying is actually critical to now, based on the election results of November, based on our folks saying, we tired of y'all, yes, I'm gonna keep my right to vote, but I ain't voting on that, right? That we have to get back into community, back into spaces like this. Look, I brought my fan. We may have to be in the trail rides and wherever else we need to be, where we are engaging and in our people's spaces.
So to that point, let me ask you, because you work with a lot of nonprofits, a lot of different agencies, and we saw this with, I tell Lisa, the organization, I want to be political, but we saw this happen with the opposition to the Public Safety Training Center here in Atlanta. There were a lot of different organizations, different strategies, with the same result, but different strategy, and somehow there was a lot of things that got messed up.
Sure.
How do you engage local organizations, nonprofits, to engage with the community? Because they may be in different spaces. They may be LGBTQ, they may be HIV/AIDS, they may be youth, it may be housing, it may be something else, it may be faith-based.
Right.
So how do you bring all those organizations together so that they know the importance? And they know the importance of community engagement.
Sure.
But right now, you might be looking for a little leadership because there's one common goal, which is to educate, inform, and then also combat misinformation.
Right. So I'm the CEO of Represent Georgia. We have a 501c3, and we sit on the state's C3 donor table, which is a combination of about 70 C3 organizations that focus on Black, Indigenous, and people of color, and that work, social justice work, that work across the state. Then we also have a C4, which is Represent Georgia Action Network, and that donor table is also a combination of about 60 501c4s across the state. Both of our donor tables are led by amazing Black women. Tamika Atkins leads Pro-Georgia. Christine White, who is an Atlanta native and Spelmanite, leads our C4 table. All right? And so we have these coalitions of all of these organizations. And I'm going to be very straight up with you. November was a real gut punch for the infrastructure, for the ecosystem. Okay? Because we were not crying wolf when we talked about Project 2025, when we talked about the harm that this Agent Orange can do. So it was a real gut punch to us. So we had to literally do some rest, relaxation, and rejuvenation to hit the reset button even for ourselves, right? Because we didn't want to be people in pain trying to go into a community of pain to do the work. So we've had to step back a little bit too. And administration that has said to us, we're going to target y'all, shut you down, and take your money. Then it becomes even more grave for the work that we do. So that has caused us to coalesce even more because the pain is deeper. And we've had to re-strategize and understand that it has to be on the ground, boots on the ground, on the doors, in communities, without it.
And I want to shift for a moment because Shana, you're with a major organization, and we talk about the work that you all been doing at the cancer side, but here's a different question for you all because you receive federal funding, correct? So are you all changing your strategy at all, or are you still going to keep that same mission-driven?
So yes and no. So with the American Heart Association, we are keeping the same strategy, the same mission, which is to be a force for longer, healthier lives. So we are still in the business of ensuring that, the leading cause, we're talking, this is the end of Women's Health Week, and women's health, our Black women are dying from a variety of things. Heart disease is the #1 killer of Black women nationally and in Georgia. And so while the strategy isn't changed from a health perspective, when we talk about words like, health equity, it may be a different or new language, but the work is still the same because where we are now in, more than 100 days, but since the beginning of 2025, $12 billion has been cut by this administration from a public health perspective. $12 billion.
And isn't it amazing that for some people, equity only means for Black folk?
Right, and it's not, right?
It's like that's
We talked about health equity, Natasha had the nice little definition and talked about, you see the circle, you talk about transportation, we talk about walkable communities, so individuals with disabilities, individuals who are homebound, equity is for all. It's creating that access so that we are all at the same playing field regardless of where we are. And so when you have things like this past week's SNAP, food stamps, food being considered to be eliminated because we want to have a lean budget, that doesn't create equity for anyone.
I had a friend who emailed me that a friend of a friend is worried about his HIV medicine. But with getting HIV medicine, he's able to go to work, and again, he can't get his meds, and he's not feeling well enough to go to work. There's that whole cycle. But I want to go back to the work that you all do, because as VP of Impact, that speaks directly to what you all have been doing. So when you talk about re-strategizing, even rewording, because I know some folks, they've had to just go to the website and do a search for equity, Black, diversity, right, whatever, replace it with another word, but you use the Microsoft word. But how are you all doing that, man?
If you know me, if you live in Atlanta, I'm in the streets, I'm everywhere. I should be at a cheer banquet right now, but I'm here. And so for me, it's about being in community with people. Like, we can't do the work if we don't know what the needs of the people are. We can do research and science and say this impacts, but when we hear it from the folks in Bankhead about what their needs are, that's the work that I strategize around and put into action. So it's talking to people, it's going to events like this, and showing up so that we can impact folks in the way that they need to be impacted. Sometimes heart disease is not at the top of the list because I gotta pay my rent. I gotta, get employment. I only make $10, $15, $20 an hour. So how do we be able to be in community with people to still have this conversation and make sure that their needs are met as well?
And also in this moment, understand that this is now definitely not the time to not get your mammograms.
This is not
Fellas, not to get your prostate screening.
That's right.
This is not the time to pull back on that. But we know sometimes folks will retreat because the economy is a little wacky right now. Inflation, eggs are $18 a dozen. Trust me, I understand. But you cannot You cannot miss those appointments. Even your regular, my dentist is probably gonna watch this. You ain't even need 6 weeks. I'm coming, but I've got to plan it out. Now is not the time to miss those preventative routine screenings. That's for everybody.
Yes.
That is for everybody.
And I'll say, it's a tough conversation to be having today, because as of first you mentioned your dentist. As of April 1st, the Office of Oral Health at the CDC is no longer there. So you don't have the scientists who can have the conversation. Back to school is coming up. They're about to be out, they'll be back again. But those dental units coming to schools and communities are important when you may not have access to a dentist. Those mammogram units are important coming to our communities when you may not have access to an OBGYN or you're not being listened to by the person that you've been accessing. We talked about No Menthol Sunday tomorrow. The Office of Smoking and Health at CDC is eliminated. So how do we then have conversations with our youth about vaping and reducing their risk of cancer and all of the things from tobacco smoke when we are eliminating these essential services?
I had a conversation with former CDC employees, and there was another division. It was a youth division for gender-based violence.
Yes.
Now, we all listen to the news right now, so I'm not gonna go there, but those programs that are now cut out, now more important, the community has to step up and offer those campaigns, and especially with our young girls, especially for our young girls and our young boys.
And I think too, in Michigan and other, our northern friends with lead in the drinking water, again, the local work is so important because while the federal is being eliminated, there are still things that we can do locally. And so I would love for us to strategize here about opportunities to get deeper on the local level.
So I wanted to add, when you're talking about all of these things that are going to go missing. So some of the conversations that we are having in our nonprofit coalitions, and very specifically the ones that work with Black folk, like Black Voters Matter, and all of these different organizations in ASB that do specifically do the work with Black people. What we're talking about now is, even for my organization, we're looking at doing employment training. It's not just about training people to run for office. I have people who've had the comfort of a federal job for many, many decades that are now going into a very different workforce that is very digital. A lot of federal people that you would talk to will tell you, some of them still working on the black and green screen, okay? And I know for the young people, they're like, what? Right? So going into this whole new workspace. So we're talking in our nonprofit coalitions about how our organizations now need to gear up to provide material support to our people. When these food programs close down, who feeds our people, right? There's a partnership with Black Voters Matter, the Sick and Tired, partnership about our sister Fannie Lou Hamer, who had all these issues not only with heart problems, fibroids, everything. When we talk about reproductive health in Black women, we're not just talking about birthing women. Because as a woman, we have reproductive health until we take our last breath. I'm surprised I ain't fanning neck. Okay, but anyway, right? But we have this challenge as organizations, as households of faith, to really restructure and re-strategize how we address these holes in all of these spaces.
And I'm going to get your questions or comments in just a moment, but I have a couple of things I just also want you all to talk about because I think it's important. We've touched on a little bit. It's two things. One is checking on your neighbors. That's what community is about.
Yes.
You got a senior that lives down the street. Go and check on Miss Johnson. She may not have lights on. You never know. And the fact that some people have to choose between their diabetes medicine and whether or not to pick light, that's a real thing for folks. So check on your neighbors and mental health. Because you mentioned, Kimberlyn, this is not the time to really sit on the sideline, but But I will add to that. Resistance is also a part of healthcare, or health wellness. And so if you need to take a break and disconnect with your mental health, you have to do that. I made a mistake and didn't do that in 2020. I lost my brother, I lost my sister, 5 months apart from each other. And I should have taken a break from my job, and I did not. I don't ever do that again.
Right.
Never do that again. So when we talk about doing this work, you can't do the work if you're not taking care of yourself. So I'll let you speak to that.
Yeah, and taking care of ourselves is important, but there's a variety of different ways that we can rest, right? Resistance is rest, as you mentioned, actual physical rest, just a mental rest, putting the devices away, not being caught up in the grind of the ticker on the news. Like when I turn my work computer on, the news is automatically there. I'm like, how do I get this off? I don't want to know this. I just want to be in my bubble sometimes and not be a part of it. And so I say, take care of yourselves if you have the luxury to do so. We're not all in the same economic situation, but whatever luxury you have, going for a walk in silence, that is rest. Getting all of the negative effects of the day out, that is rest. So driving in silence or being on, public transportation in silence is rest. And so I offer that as well, because the days can take a toll, and the days lead into weeks and months, and before you know it, it's 4 years from now.
Absolutely.
We're also encouraging you to talk about sabbatical policies with your boards, with your HR representative. I know with my 3 boards, we have created a sabbatical policy. Sabbaticals used to be something that only happened on college campuses, or only CEOs were able to take sabbaticals. But research tells us that sabbaticals are effective. I mean, look at just what happened during the pandemic with people being able to work from home. How productivity, that's why I understand why, these people up here at 1600 Black Lives Matter Plaza want everybody to go back to work, because the truth of the matter is that productivity didn't change. As a matter of fact, at some jobs, it went up with people being able to work remotely, work from home some days, and in the office other days. Right?
You look, if there was someone that got on your nerves at work, you didn't have to look at it. I was so happy. Because it was just me, my producer, the engineer, and the whole building. And I was like, all right, I gotta see him. Don't y'all treat that. Rose Scott said she had all her coworkers.
Yeah, I see it.
But also this, if you're not okay, if you're not feeling well, and someone asks you, girl, how you doing? And I used to be that person, I'm okay. I stopped saying that. And I'll tell you who I learned that from, a white male. I went to Ryan and said, Ryan, how you doing, bro? Like, what's going on? He said, Rose, exclusive, I'm not well. I hate all of this. I'm not well. And I'm tired of telling people I am or I'm not. And I thought, you know what? I'm not doing it either. So if you're not well, you're not feeling okay, you feel like you're at a breaking point, hit up your sister, your best friend, your homeboy, whomever. Don't suffer in silence. That's the worst thing you can do.
I'm so glad you said that, because we need to apply that to young people as well. See, I grew up at a time, if I said I had a headache, they told me to go outside and play. How about anybody else can do better amen? But we have a generation of young people who have more agency now. If they tell us that they're not well, they tell us they aren't feeling well, I don't want to go to school, I'm not crazy about how this teacher feels.
There's strength to that.
We have to lean in. It's important that we lean in.
Absolutely. Let's get some questions, comments. Just raise your hand and we'll get to